but there's just something nagging about this hip pain when this muscle is strained or irritated or not functioning properly. It creates what we call urinary urgency. You probably just need an internal muscular examination to go find this muscle. Today we are going over hip pain that just doesn't seem to go away no matter what you do on your own. Maybe you've been to physical therapy, chiropractic, acupuncture, massage therapist, and you might get a little bit better, but there is just something nagging about this hip pain that you can't figure out. And no one else seems to be able to figure it out either. And it is driving you crazy. Usually, this hip pain occurs either right here or on the side of the hip. Sometimes it can even present as SI joint pain. So, right in the back here in this area. And so, if you're having that hip pain that maybe migrates in the pelvis and you can't pinpoint exactly where it is, maybe some providers have told you, hey, that's your IT band, your tensor fascial lata connecting to your IT band. Hey, maybe that's your glute medius and minimus muscle. And they try to release it and work on it and balance both sides, but it just doesn't seem to go away. Oftentimes the missing link to having hip pain that is excruciating, and maybe it gets worse with activity, sometimes it gets better, you can't seem to stretch it out, no movement seems to take this pain away, and it's just kind of dull in your pelvis. I want to tell you where this hip pain is coming from, and it is no surprise that oftentimes it's coming from a muscle deep inside the pelvis that we can't reach externally. So when providers are looking at just the hip motion and hip muscles and putting you through all these tests and they're not quite recreating your symptoms, the issue is because they're missing what is actually causing the pain. What is actually causing the pain a lot of times in chronic hip pain that just doesn't seem to be pinpointed by any provider or practitioner is called the obturator internus muscle. You can have a strain of this muscle. This muscle is located deep inside the pelvis. So here's the pelvis here. This is the outside of the pelvis. This is actually the muscle. But because there's so much soft tissue covering the muscle, it's hard to pinpoint. So when you feel this pain, it's not surprising that you feel it in this area right here. So, how do we heal this? Well, this is where an internal pelvic floor examination becomes extremely important. And now there's a lot of issues with people performing internal pelvic floor examinations, and a lot of people aren't skilled in finding the dysfunction and the strain in these muscles and or scar tissue. And if they're not skilled in finding it, this muscle is hard to hit even inside the pelvis. It underlays other muscles inside the pelvis. So you have to be able to work your way to this muscle skillfully. And a lot of providers miss this. And so people go years and years with this chronic hip pain. A lot of times they end up getting oftentimes there are like labral involvements, or maybe you've been diagnosed with femoral acetabular impingement, but in reality, it's not that at all. And if this muscle was just healed, it would allow the femur to move in the socket without pinching. And so a lot of times this pain gets diagnosed as that labral issue. And so when you get fed up enough and you've had the cortisone that didn't work and you've had, the endless PT and chiropractic that didn't work, then you end up going down the route of surgery. And the reality is you just needed pelvic floor therapy. And pelvic floor therapy would have healed and created new alignment for this muscle, making this muscle healthy again, improving the blood flow, creating normal movement. And if that had happened, then you wouldn't have gone down that path of needing labral surgery or any hip surgery for that matter. So if you have chronic hip pain that just doesn't seem to go away, the number one thing you need to do is get yourself to a pelvic expert physical therapist. People fly here from across the world to come to our clinic and receive this care. A lot of times people will come for an intensive where it's a week of therapy and then fly back home and, continue on with working on the things we give them here, but they're healed and they can take the new healing that they've developed here and create their new patterns and work on that at home. And so that is really special. If you have this chronic hip pain and are fed up enough, please reach out to us. You can email us at support@bodymotionpt.com to set up a consultation for a intensive therapy session. So back to this obturator internus strain. So when we strain the obturator internus, whether it's from an aggressive ski day you had one winter, or maybe it's from increasing your mileage with running, you name it, this muscle can get strained. And if you're a female who's had babies or you've had chronic pelvic infections like UTIs or bacterial vaginosis, that can lay down scar tissue. Babies can lay down scar tissue just from the trauma inside the pelvis that occurs when we're delivering. And if that's the case and there's scar tissue there, that's going to make it, once you strain your obturator internus, it's going to make your obturator internus even harder to heal, more so than a hamstring or any other muscle in your body, because of its location and it being bound down by scar tissue. So part of the healing process is we get next to this muscle, we do intravaginal examination to really work out these muscles, get rid of the scar tissue, develop new blood flow, and get rid of the chronic muscle strain and balance both sides, so that frees up the hip. Once the hip and the muscle are balanced and freed up and can move normally in the socket, then we can start developing more of a core strengthening program, building up the glutes musculature to really reinforce taking the strain off the obturator internus muscle, and also taking the strain off the pelvic organs, taking the strain off the low back. So the glutes are really important when we are healing the hip pain. But a lot of times what happens is people go to providers, they get the glute strengthening, but they never heal the actual muscle that was injured. And so it just chronically is irritated and irritated. They might be in and out of having what's called a hip bursitis. So if any of this is relevant to your story, I want you to know that you probably just need an internal muscular examination to go find this muscle, start releasing this muscle, start healing this muscle, allow the fibers to heal so the muscle can contract and relax more normally. A lot of times when this muscle is impacted, there are other functions that start to bother you. Now, this might not be true for you, but a lot of times what happens if this muscle is strained is all of a sudden deeper penetrative intercourse can become more uncomfortable. It can feel like your partner's hitting something with deeper thrusting. When this muscle is strained, you also might have urinary urgency. So feeling like you have to go even though your bladder's not full. Maybe you went an hour ago. There's no way your bladder's full after an hour, but yet you still have to go. Maybe you go pee and then right after you go pee, you still feel like you have to go. Maybe you see running water and then all of a sudden you have to go. That would be called urinary urgency. And when this muscle is strained or irritated or not functioning properly, it creates what we call urinary urgency. So those are two really common things. You can also feel like more lower abdominal cramps, especially if you're menstruating and you don't normally get menstrual cramps. All of a sudden things, because that muscle is so tight and it's pull on the fascia on the uterus, it can increase the cramping that you get during your menstrual cycle. These are just a couple of the telltale signs that your obturator internus might be driving your chronic hip pain. I'm Dr. Allison Felt. Thank you so much for joining me. I hope you found this video insightful into your body and into your chronic hip pain. Please reach out if you have any questions. Visit us at bodymotionpt.com or leave your comments below. Like and subscribe to this video, and we will get you more content. We put out videos twice a week, and I love hearing from you and conversing with you in the comments. Take care.